All right, if I can't talk you out of using a goniometer or focusing or fixating on range of motion, let me at least show you guys how to do it properly. Basically, what's gonna happen is your therapist is gonna sit or stand on the side of the table. They're gonna set the goniometer pretty much to where they think you're gonna be. Maybe they think you're at about 105 or so. They're gonna ask you to bend your knee. Maybe they're gonna ask you to pull it in tighter. You're gonna get to your end available range of motion. Now the therapist is going to try and line up one arm of the goniometer with the lateral malleolus through the fibular head as a straight line. The second arm of the goniometer is going to go through the greater trochanter through the middle of the knee. The problem is, if you're talking about the difference between 92 and 95, 103 and 108, these are minimal differences. We're talking like fractions of an inch different. So if you really want the best chance at getting consistent, reliable, repeatable measurements to show improvement, what I would do is I would measure at the beginning of the therapy session. As soon as you walk in the door, you're stiff, you're cold, you're gonna have the least amount of range of motion. I would set up the goniometer properly using the proper landmarks, and I'll try my best to create a second video showing you some ways to do this better. But then what I would do is I would get a Sharpie, I would mark the bottom circle, I would mark the center. If you can't actually get it through the hole in the middle, I would set it up so that I mark it on the skin and then I line it up there. I line up the bottom line, and then wherever you get lined up through the middle of the femur, I would set my third dot. And now what I've got 1 dot, 2 dot, 3 dot, so that when I do my exercise, when we do the manual therapy, when we do all of the work to increase range of motion, whether we're talking extension or flexion, when I go to line the goniometer back up a second time, I've got proven landmarks that are going to be in exactly the same spot. This at least gives us a better chance of accurately measuring change during the therapy session. And most patients will improve. I had a patient this morning. We started at exactly 80 degrees. We improved to about 87 degrees. Those aren't great numbers for flexion, but those are numbers that show absolute improvement during the therapy session. Guys, I hope this little tip was helpful. If you have other tips and tricks, if you have better ways to measure range of motion, let me know. Let's share it. Let's tell other people how to do it. I'll catch you on the next video.